All right, thank you everyone for being here. This is the Justice Project Oversight and Planning Committee meeting. It is September 18th, 2025. It is 2:02 p.m. and I officially call this meeting to order.
Wait, Marty, can you flip this slide to the next, please?
Before we begin, we acknowledge that we are gathered on the traditional and unceded territory of the Lummi, Nooksack, Samish, and Semiahmoo people who have cared for and tended this land since time immemorial. Truth and acknowledgement are critical to building mutual respect and connection across all barriers of heritage and difference. We begin this effort to acknowledge what has been buried by honoring the truth. We pay respect to their elders past and present. Please take a moment to consider the many legacies of violence, displacement, migration, and settlement that bring us together here today. And please join us in uncovering such truths at any and all public events.
Okay, welcome everybody. Glad you're all here. I'm going to just go through a couple of the logistics. So remember to keep your video on as much as possible. Keep yourself muted except when speaking. Remember, these are open public meetings. They'll be recorded, and we have complete notes that go out, as well as the video that gets posted to the Justice Project website. Whenever we are in the open discussion mode, please raise your hand to be recognized to speak, or you can use the raise hand button. I will pretty much be able to see both of them. And when using acronyms, try to remember to define what they mean. So those are our logistics. Next slide. All righty, so we have a really rich agenda for today. We're going to debrief the August panel discussion and talk about a plan for another panel discussion that we'd like to have in October. And I really want to give hats off to our co-chairs, to Hannah Sloan and Tasha Thompson, who have just been really so brilliant in thinking through how to make these JPOP meetings really rich and informative and make sure we're upholding our responsibilities to bring voices to the table. So it's just been such a pleasure working with them. So that's what we're going to do for the first part of our meeting. After we do kind of like more getting ourselves oriented, then we have a lot of updates at this meeting. So the visioning work on the 23-hour crisis relief center and behavioral care center. I'm so glad we have Adam Johnson here today to talk about the jail and BCC design process. You know, what's missing here is we have Riley Sweeney here, who's going to give some updates on the communications, things that he's got going, and then we'll talk about vacancies on the JPOP committee and close it out with public comments. So we have a lot of great stuff to talk about today. So any questions or comments about the agenda?
I have one request.
Yep.
If you're not speaking, could you please mute your computer, because there's a fair bit of background noise? Thank you. All right.
Thanks, Marty. Okay, any other things that need to be addressed? Okay. And unfortunately, Tasha the more I learn about her work, the more amazed and humbled I feel. But she is dealing with some crisis stuff, and so she couldn't be here today, unfortunately. All righty. So today's agenda is done. We've reviewed it, and Marty, over to you.
All right. I just want to say that every quarter or so we send out the JPOP Committee's 2025 action plan, and that's just to help keep everybody oriented, let you know where we've been and where we're going. And I will just review the last couple months that I make what has passed, kind of gray it out a little bit, but that was when we had our panel discussion in August. Today, Holly just reviewed what we're doing, and coming up in October will be our next panel discussion, and then we're going to get into year-end reporting. We have a role as a committee of the IPRTF in contributing to the year-end and annual reports of the IPRTF, so we'll be working on that. And just a little teaser, in November, we're going to do some more about reporting and also work on the action plan for 2026. So that's what's coming. Okay. So
Great.
now we get into the heart of it.
All right. So hopefully that's fresh in everybody's mind, that last meeting we had where we had that amazing panel discussion. And we have some questions to discuss. So the next slide, please. Here are our discussion questions. So what key points from the August 21st panel discussion on frequent incarceration stood out for you? What are the gaps in the criminal, legal, and service systems do you feel are the most important for us to explore? And who can we invite to help us better understand these gaps in the systems and shed light on ways to address the gaps? And we want to be thinking about people with different roles in the systems, not be brainstorming specific individuals today. So the way we're going to do this is we're going to take the first two questions kind of together, and we'll do it just people can raise hands to speak. It would be terrific if everyone had a chance to speak once before anybody speaks twice. I might invite you to speak, but really we want to just hear, like, if you can remember back to where we were, and we've listened to all of this feedback on people's personal experience, either as somebody who has had an experience of frequent incarceration or had family members, you may recall, who had that experience, like what really jumped out at you, and then really digging down into what are these gaps that we could potentially address and be thinking about what would be meaningful, because that's going to tee us up for the October session. So we want to get as specific as we can in that, like what can we really think about are things that we can change, and then start thinking about who we would invite to the table to help us really be informed about that. You see where I'm going? So it's like, here we have this conversation, let's see if we can deepen it. That's our aim here. Okay, so those are the two questions. I'm going to go ahead and have the screen stop. Pull the screen away, and just love to hear from everybody on what they remember and what seems like really important points of gaps that you heard that we should dig down into. And Hannah, I'm sort of hoping you're going to start us off, because man, when you were riffing on that during our planning team meeting, I was my jaw was dropping. You just have such insight into these things. So would you be willing to start us off?
Yeah, thank you, Holly. I think what stood out to me most was just how similar everybody's experiences were and how they identified a lot of the gaps that we've already identified in our assessments and what's identified in the Justice Project. So that was really great to see that we're kind of on the right path, and that there are things that have worked for them that can be great successes for more people in the future. And then also, I just really enjoyed how they could learn from each other, especially the parents who have a loved one in the system, and seeing that there is hope and that other people are going through something similar, and hopefully they can, build a community out of that, because it's a really stressful thing to be a part of, and you really need a lot of support to get through it. One of the gaps that I think would be important for us to focus on is, we always need more resources and expanding different programs. But the biggest thing that I encounter is we're all siloed. And I think this has come up a lot, where so many different providers are providing similar services, and we have the capacity in a lot of situations, but the coordination and the collaboration just isn't there. And so making sure that we have the proper people and the proper procedures in place to make sure that these separate systems are coordinating well together and leading to the success of the client. We could come up with a perfect reentry plan for a client, but if they get released at 2 in the morning, because that's when the court paperwork says that they need to be processed is immediately, then we lose them to contact and they're out potentially going back to an unsafe location, an unsafe situation, instead of waiting, 6 hours for 8 a.m. to come along where we could get them into appropriate housing or make sure that they have somebody hand in hand with them, getting them to a safe location and proper services. So just really collaborating and working with what we already have, because we know that we need a service expansion, but we also need to do better with what we do have.
Great, thank you. That was a wonderful start up there. All right, who's next? What did you remember that stood out to you, or gaps that you think would be good to focus on?
I'll go. This is Rob. I think similar to Hannah's comments, just that really that need for collaboration and the need for how do we manage the multiple systems that somebody's involved in so that we're not, as Hannah so eloquently said, not left out in the dark by themselves in the middle of the night, because that's when they should be released. I think for people that you come out and you have to make a decision right then and there. Am I going to go left to what I know, or do I go right to what I don't know? And I think people with no support are going to go left more often than they're going to go right.
Yeah, thank you. Peter?
Well, first of all, I'd like to say that I wasn't at this meeting last month because I was on vacation, but I reviewed the video. It was fantastic. Anytime that we can hear people's experiences, it's just so powerful for all of us, especially those in kind of more policy realm. The frontline workers, often get this experience, but I'm so thankful to JPOP and the programming here is important. I agree that what I heard, as powerful it was not something that was particularly new, and that are thankfully all the work we've been doing over the last 7 years has captured these concerns, and we have an implementation plan that addresses them. Now, but that's, it's easy to put things into a plan, and as people were just saying, it's the coordination. I can't remember which project it is of the implementation plan, but coordination, communication between all these silos, it's critical. And we have not done nearly enough in that regard. And that it accounts for a lot of our gaps. Something else that came up was I thought of Raylene King, who is chair of our IPRTF Legal and Justice Committee. And every meeting, it seems like she is talking about how we do not have enough attorneys to make this system work. And you heard it from a number of the panelists that the delays in the legal system are really devastating. And we have a lot of churn, and every time we lose a prosecuting attorney, for instance, we then have to reassign 50 cases, and it just pushes everything down the line. And so there's a lot to do there. The last thing I just want to say is sometimes we really don't like to hear this, but there is a great role for a jail in keeping people from their supply and holding people accountable. And I've heard that story over and over and over again. And that is really important, that accountability and that keeping people from their supply so they can finally get clarity. of mind. And I'm very much looking forward to the new jail that we're planning, designing, and building, because we're going to have far more supports, behavioral health and SUD supports in the jail and out. So thank you.
Thank you. Okay, Amber, you're up.
Yeah, thank you. It was really great to hear from everybody. One of the things that I heard repeatedly when they were talking was sort of how the accountability, people not wanting to go to prison, that kind of came up multiple times, where they were either were going to go to prison or they needed to go to treatment. And, you know, I think that shifted a lot of the people that were in there and forced them to go to treatment. You know, and with that, full disclosure, like, I'm in recovery. Those of you that know me know that I'm in recovery, and that's how I got there, right? Mine was either go to prison or go, and so I could relate to that decision. And so when it comes to gaps, you know, I'll be fully honest. I have a stepdaughter who is 24, and she is fully addicted to substances, living on our streets of Bellingham. We go and look for her every 2 weeks. And I'm not telling that story, but to say that, like, she's been arrested and released and arrested and released because her charges aren't significant enough to hold her. And we just keep praying that she will get arrested long enough to have to go to treatment. And that is, like, I think that is a gap in our services, right? Is like, the charges aren't, you know, a possession charge. Those changes, I think, changed kind of, people aren't getting arrested for simple possession. Because yes, it is a behavioral health, but in order to get to that, where they have an option to see it as a behavioral health, you know, we're not doing anything. So I think that there's a gap there. Additionally, I think that there's a large gap in the detox inpatient. I'm not sure if any of you are familiar. A person comes in, gets an assessment. They've made that life-changing decision that they want to go to inpatient. Great. They have to go to detox first, which is a different level of care. It's a level 3-7. And there is a gap between getting them a bed date and getting them detox. So oftentimes what happens is individuals go and they detox, and then they're released back to the street until they can get their bed date. And now they miss their bed date because they need detox again. So there's a huge gap, and, you know, they won't take them. And so that's another thing. Maybe, you know, you said bring in people, you know, like an inpatient coordinator would be a great person to maybe interview and discuss, like, you know, maybe question them about gaps. And we do have one at our agency. I know that there's other people who work in the SUDP. Rob, you're over there at Pioneer. So yeah, those are just kind of some things that I saw and noticed. I'm sure those are all things that everybody is aware of, but yeah.
Yeah, I don't know that we are, actually. I think that's part of the JPOP. That was so great, Amber. Thank you for sharing those pieces. Yeah, excellent.
I have one more that I wanted to say is in regards to the legislation. I was working as an SUDP when the legislation changed to that it is no longer a felony to possess substances. And I was working, I had an IOP, and actually what happened is a bunch of people, their charges were reduced. They no longer were felonies. They were released off of DOC, and they all stopped coming to IOP because they were no longer required to be an outpatient. And so I saw across the board a drop in people who were no longer on DOC because it was no longer required of them. And so that's like another gap in, like, how everybody, again, people probably have different opinions on this legislation. And so I don't want to get into my own opinion, but that whole accountability factor and what it did to, because individuals were no longer required to be in treatment, it actually took people out of treatment. So I wanted to share that as well.
Thank you. Hey, Amber, would you go ahead and define DOC and ILP, if I heard you right?
Sorry. DOC is Washington State Department of Corrections. Individuals who previously had drug charges, they are put on Washington State DOC for supervision. It's a type of probation, essentially, a little bit higher because it's on the state level. And so a lot of them would have to report to them, be required to report to them if they have past drug charges or convictions. And then IOP is intensive outpatient.
Oh, IOP, intensive outpatient. Super. Thank you. All right. You good? Is that it for now? Okay. Miriam?
Yeah, I think I wanted to, well, first I wanted to ask, are we answering all three questions or are we just answering the first one for now?
We're gonna aim for the first two, but then Amber just threw in the number 3, so it's go with what's coming up for you.
Okay. Well, I think part of it, as I'll answer also, or kind of speak to what I've heard so far, around what works best for treatment options. I agree with the gap in the long-term treatments, and continued treatments. I think that I believe that we're also brilliant enough to come up with more ways than keeping people in jail to essentially get them off of substance. I think that's one very specific way of looking at substance use. And I think that when we think about anecdotes and the qualitative, the storytelling, we're looking at one piece of it. And I think overwhelmingly, the statistics show that jails as they currently are not working to really help the broader community. So I think that's something we can all agree on because statistically it's here, and that's a fact. And then so to that end, I'm really hoping that this forces us the feedback from folks. And I wasn't here, but I read the summary, and I'm hoping that this feedback helps us develop ways that not necessarily develop ways or systems that are currently in use in the States or even currently in use here that we know are not working, but we go beyond and kind of think and get more imaginative about what could actually work and serve us all long term. And then what stood out to me was and I think, I'll probably echo what some people have said already. A lot of it was not surprising, but what stood out to me is the piece around housing, how housing is so important in keeping people from being reincarcerated. And it stood out to me, not because it's the first time I've heard it. It stood out to me because it finally clicked for me that I think our Justice Project and some of the things we're planning on versus what essentially, I think we all have a different definition of housing. And I think maybe this group potentially sees housing or jail as housing. And I think a lot of the members in their community don't see jail as like a form of housing. So, because I hear, if they're in jail, then they cannot get access to drugs or substance. So they're housed. And to me, I'm like, I think we fundamentally have a difference in definition of housing. And I would want us to explore what housing looks like in, a behavioral care setting versus just a bigger jail. Because I think one of the comments was, we need a bigger jail and we need more beds. And that was, to me, I'm like, long term, those don't benefit the community, statistically speaking. And so I'm just trying to think about what our definition of housing is, what we mean by housing. Because I feel like there's a huge discrepancy between what we think is housing and what other folks in the community see as housing on either sides of people who oppose a jail or don't or for a jail.
Okay, so let me just reflect back. I'm hearing some resonance here with this question about, what are the other ways that we can help create some environmental pressures, shall we say, to increase the accountability for people when they're struggling with drug addiction, and that and I think what I heard you say, Miriam, is like thinking of creative ways to create that accountability, and that maybe we could spend some time thinking creatively about that. But I didn't hear you say, did you have a specific suggestion, or you're just saying you would love to have that conversation?
I'm saying I would love to have that conversation, and I would also love to have the conversation around how we define housing.
So, and I also just want to reflect back. I have not heard anyone define jail as housing in the Justice Project arena. But is that something you're hearing in the JPOP world?
Well, yeah, that's something I'm hearing, and I could be not interpreting it correctly, but I mean, I just heard Peter Fraser say some like housing, if we house them somewhere, they don't have access, and so and those are things I've also heard from people who were at the decision-making table when the Justice Project kind of started in the tax was put on the ballot, was like, we fought for housing for people, and housing is the jail essentially. And so those things have been said. So I just want to make sure we're all on the same page.
Okay, I don't know that we would all agree with that, but I think that clarification about how we define housing, I just want to flag and reflect that's a conversation you'd like to have and make sure
Yes.
we're understanding the same thing.
Yep.
Got it. Okay, Stephen, you're up.
Thank you. I hope I can interject here as sort of an adjunct JPOP member.
Yes, you can. You get special privileges, Stephen.
First off, I thought the panel was just superb. It was the best panel I've seen through multiple years of this process, and I really commend Hannah for assembling that group. Very valuable, incredibly brave and articulate people. I'm probably diverging from the questions, and I apologize for that, but I just had two thoughts that I'm carrying with me since then that I'd like to drop into the discussion bucket. One is that most of the panel conversation and virtually all of the feedback so far has been focused on people with substance use disorders. And there's an extraordinarily high percentage sometime overlapping, sometimes not, with serious mental illness. And we haven't talked about the presence of that, how to treat that, the means of treating that, how to deal with co-occurring disorders. All of those seem to still be conundrums that we're not really engaging with because they're so gnarly, I think. And the other issue I come away with wondering about is I really liked Amber's raising the accountability and the tension between not incarcerating people but having accountability. I frame that as the conundrum we have with voluntary and involuntary treatment. And I don't think we've wrestled with that and come up with much of even some options with that. So I don't see how we're going to succeed with this very well without having a better handle on what we do with that question as well. So those are my comments.
Great. Thank you, Stephen. Dean, you're up.
In terms of answering the third question about, who can we find to help us work through these issues, how to resolve the gaps. I wanted to mention that, as you may recall, in the Justice Project Performance Measurement and Evaluation Plan, there's a short-term recommendation to update the sequential intercept model. And I think the reason that relates to this question is if, as we work to not simply itemize more things that can be of service to the community at various intercept points along a person's course of interaction with the justice system, there is also an opportunity to understand in more detail what the actual flow of things is and how the processes variously work. And in that regard, about a year ago, the health department had approached the administrative office of the courts at the state, the Supreme Court office, about helping to do an update of the intercept model. And we had a fairly lengthy discussion with them about that. They have a staff person dedicated to that work and others who support them with the Whatcom County because of so much activity going on with everybody's time being involved in the IPRTF and coming up on the JPOP work and so on. But now that we're at this point and the IPRTF has actually endorsed that evaluation plan. We've been, that is to say, the health department staff, Melora and Hannah and I particularly have been talking about reapproaching the AOs, the Administrative Office of the Courts, to again ask them to help us plan what would amount to a workshop, probably a weekend or a series of days, to do an update of the sequential intercept model that would help to answer some of the process questions about why we have gaps. I was authorized to approach Heather Flaherty at Chuckanut about whether Chuckanut would be willing to partner with the county in approaching the state to organize such an activity, probably sometime in the winter. But I just wanted to get that on everybody's radar, that may be a means by which we bring the voices we heard last month and others to a much more formal and organized table to actually workshop, what the issues of gaps are and the flow of people through this system and out into alternatives. So just wanted to offer that up.
Great, thank you. Yeah, it's one way we can approach it. Wonderful. Go ahead, Peter.
Dean, that is such good news. We really need an update, and sounds like a great process. I'm in full support. Also, I'd just like to state for the record that there is no way that I consider jail housing, and that it was interpreted that way is beyond me. I don't see how that is possible. And if you'd like to take it offline, be happy to talk with you.
Okay. So let's do two things. Marty, if we could put the slideshow up right now for just a second and go to the first slide, because I want to orient us to the whole of the Justice Project. So I think always a good moment. That's why we put it at the beginning of every single meeting. So the implementation plan the Justice Project implementation plan includes all of these different elements, right? And so if you look at here we have the long-standing, ongoing community health improvements are on the left-hand side of the screen. More behavioral health services, more support for children and families, more housing and homeless prevention. Then we have all the systems for incarceration prevention and reduction, which the IPRTF has been working on for a long time. Then we have all of this world of healthy and humane facilities. So we've got all of this stuff that I think typically would be considered housing of different types and supportive housing and crisis relief. We got a whole world of that. And then our outcomes, right? So increased health and safety and accountability of our data, inclusion in that process and transparency. So that this one on the far right is also one of the key responsibilities related to the JPOP, right? Like paying attention to how do we measure our outcomes. And that's all that work we did with Village Reach. So just remember that we are looking at that holistic vision of the Justice Project. Okay, then I would like to go please down to the slide because we had a couple people join late and I want to make sure you're tuned in to the questions we're answering and hear from everybody who hasn't spoken yet. So here's the questions. We have about half an hour left in our discussion today. So what key points from the August 21st panel discussion on frequent incarceration stood out to you? What gaps in the criminal, legal, and service systems do you feel are important for us to explore? And people have offered some great suggestions. And who can we invite to better help us understand these gaps? So if we were going to dig in deeper in October and subsequent meetings, what are the kinds of things we could, focus points for a panel and the types of folks who could come and join us and inform us, right? So that's where we're at right now. Those are the questions on the table. Love to hear from people who haven't spoken yet. Miriam and Amber, I see your hands, but I'd like to hold, please, and just give other folks a chance if I could. So other folks who haven't spoken yet. Andrew, Dan, William, Kelsey, Jason, Caleb, there's a lot of you here. Who else? Just things you remember that struck you or stuck out for you. Jake, Satpal, Pamela, yes, please, you're up.
Okay. What stuck out to me? Oh, there was so much. Well, I like the fact that the availability of an inpatient is a big issue for our community. I think we have Baker Creek as a co-occurring inpatient, and that's about it. I think that's it. So what are the possibilities around getting more options for inpatient drug and alcohol? Because, missing that opportunity from the detox situation to meet that need, and also if somebody's ready to go on and get even more sobriety under their belt, and that getting released from incarceration and not having those kinds of supports and that kind of option to go to treatment out of incarceration is huge, and it's just a huge missed opportunity. We're just losing so much ground if somebody gets back out and doesn't have the supports. And then the next, of course, is housing. So if they've got the sobriety thing and they got everything they needed and they still don't have housing, there's still another huge gap and opportunity for things to fall apart and for them to not be successful and not find stability. And so, yeah, inpatient in our community, or, access to that for getting people there and back safely to what we currently do have available throughout our state is a big deal. And then again, like having a well-developed plan. The other part that really struck me was like lack of counseling while incarcerated, or lack of treatment while incarcerated. So that can really get the ball rolling for somebody to feel empowered to start their recovery journey. So that's extremely important. Each one of those steps, I mean, it's just, you can't understate the importance of somebody's taking advantage of that moment when somebody's feeling motivated, ready, inspired. I'm not sure. There's probably a lot of words that could go there to improve their lives, and then not having the support. So I'm all about like the communication and, how can we collaborate? Maybe some of those mental health services could be people from our community coming into the jail. I do mental health services, and I've never been invited to go to the jail and provide, if they've got some classes that are structured and ready to go, and they just need a person to with the credentials to, execute that. There's possibly room in my world to be able to be one of those providers, and there might be others like me that could. So putting out that invitation and getting that coordination communication going to do the best with what we have, and ask that question about what we can add. So who could come speak to that? I don't know. We do have a behavioral health crisis intervention meeting once a month, or once every other month, which has a large number of our behavioral health clinicians in attendance. I know Rob's present at that. I attend it when I can. So maybe that's a place to ask that question, like where we can get some expertise to talk about how do we bring more to our community or utilize what we have more thoroughly.
Great. So let's flag that as another potential one. And thank you for reflecting that from the speakers. I remember this as well, like what is happening in the jail to give that direct support. Yeah. Okay, what else do people hear? Looking for people who haven't yet spoken. I'm gonna pause here and really give you a chance. Hannah, Scott, Caleb. Okay, well, if nobody else wants to speak, we're going to go ahead and hear, I think both Amber and Miriam, you guys would like to speak again?
Yeah. So I wanted to note, because one of the things that I've learned from my elders is that when things get confusing, it's really nice to clear the air in the moment. And then before you like do the more localized, like take it offline. So my interpretation of it, of the jail housing, is because they've been used in the same context, including in the context of the more recent capacity needs assessment and the support of the Incarceration Reduction and Prevention Task Force of that capacity needs assessment for the jail. It's called special housing. And I think part of that interpretation is also lack of information, which I will own, lack of information for the plan of anything beyond a jail. And I think that's what feels crunchy, because when things are named special housing in a context of jail beds, it's really hard to try to interpret it any other way, especially when you haven't seen plans of anything else. But I'm hearing that we will hear directly from the crisis center and also the behavioral care center, which is really exciting. To that end, the Whatcom Racial Equity Commission we're completing our analysis on the incarceration data from Whatcom County. We looked at 2023 and 2024, first looking at the racial disparities, Racial Equity Commission, so we're always going to look at race, of course. And we're seeing racial disparities that have worsened since the last time there was a disparity index that was done. To that end, our hope is, so we looked at the racial disparity. We are also looking at offenses and charges and trying to essentially get a better understanding of what are people most being incarcerated for, and trying to inform some of the behavioral care center interventions. I think the belief is that, because I think we've talked a lot about substance use, and I think when we think substance use, we think drugs specifically. We're also seeing a lot of alcohol-related crimes or incidents, and so I think for us to have something around that would be extremely helpful, which is something that I read was a feedback from last month's meeting. And essentially, we're looking to see what interventions are out there that work really well, that involve more than just incarcerating the person and reincarcerating them if they fall, or if they, the road to recovery is not linear. So that's kind of the plan. And I'm saying this because as an offering, I mean, our hope is to present to the JPOP our findings and our recommendations and call to action, because I don't believe in doing research and analysis without a call to action. And so first, clearing the air, and happy to take it offline. Y'all know I'm always available to chat and understand what's going on, and that's why I ask so many questions. And second, an offering for a side I believe we haven't really looked at, which is some of the racial disparities, which Julia at Village Reach did put in her analysis of the impact assessment, that it would be really important to look at that. So exciting stuff. So I don't know if we'll be able to get into the agenda for October, but we want to present.
That sounds great. Thank you. Yeah, it's like we're getting to that point, and it's kind of exciting. We have more content than we have time, as it should be. And thanks for like just you said a term I want to hear it again, because language matters, right? And I think what did you say? You said something you talked about the capacity needs assessment, and then you said like what kind of housing? And you said this is how you're hearing it.
Special housing.
Special housing is what you're hearing kind of in the BCC conversations, is the term you're hearing?
Special housing, that was, yeah. There was not I mean, I didn't see the full presentation myself, but I know other because a lot of the members here are part of other committees as well, or part of the bigger workforce. So they know more, but again, it was special housing, numbers of beds. They did call it special housing, and there was a bit of confusion and lack of clarification on whether that was in the jail or the behavioral care, or that was the behavioral care. So therefore, if you don't have a lot of information, you're probably going to make assumptions, especially looking at like our history and everything. And also, y'all know I'm out in community, so I meet with folks who are on this big spectrum of beliefs and ideals. And so I hear a lot of different opinions. So
Yeah, thank you for that. And yeah, it's good because we've got Caleb here and we have the folks, where are they? I'm trying to see. Adam's here from STV. And to be clear on our language, right? That's part of why we say, let's define our acronyms, because it really helps us just stay on the same page. So Amber, I see your hand up, but also Caleb, were you wanting to do a direct response to Miriam's question? Because I'll bump you in front of Amber unless you just have your own thing.
No, I just wanted to respond specifically, because as I was thinking about this, Miriam and Peter, this is the thing that comes to mind is in a jail setting, we often describe things to differentiate between services like, kitchen or laundry and housing, which is where people stay while they're in custody. So when we describe things in the context of a housing unit or special housing unit or things in that nature, it really is to describe a difference between people where people stay while they're in custody and the core services of the facility. And so it's not to be a replacement for housing in the community. It is just to differentiate between those two sections of a facility like a jail. Hopefully that helps to clarify.
Great, thank you. And that really does make sense then, Miriam, why you were hearing that, which I was not hearing. But yeah, thank you, Caleb, for clarifying that. That was excellent. Pamela, your hand is still up, but I think you're not in the stack anymore, correct? Think so. Okay, Amber, you're up.
I wanted to throw another resource in the hat for possibly bringing to our panel. I'm not sure if people are familiar with the Snohomish County Diversion Center. Has anybody heard of the Diversion Center? Yeah, it's a really great program, and it's a shelter, but it's a substance-free shelter, and they transport and bring people. And so I do a lot of cross-site assessments for Everett. And I always am like, wow, I really wish we had something like that up here. And so I think it would be valuable if we had, somebody from, who's helped put together this diversion center. And we could kind of see how that's helped, because it is a shelter. It's a 44-bed facility, and it offers short-term placement while they are waiting for either getting into inpatient or upon release of inpatient and trying to get into a housing setting. They have on-site medical staff, but they have to be sober if they're there. So it's very interesting. So I think that would be, I saw some thumbs go up if, it sounds like other people have heard about it, to kind of see how that's working for that county. So that's all. I wanted to throw that in the hat. Thank you.
Thank you. Wonderful. Okay, I thought I saw another. Who was it? Somebody else. Was Jake, was it you who wanted to speak?
Sure, I'll hop in here if that's all right. Yeah. I don't want to, I know this has been taking up quite a bit of time here, but I do feel it's real important. I was just going to shine some light further on the gap there with SUD treatment, inpatient specifically. In the probation department, we've had a lot of great resources, whether it's substance testing or ankle monitoring bracelets or handheld alcohol devices, multiple ways to be able to assist folks in conjunction with outpatient services and helping their, trying to get them the help they need to get well. But sometimes, honestly, it just isn't enough and doesn't work, and they're not willing. And the need for inpatient is certainly there. And if they don't have the ability or the resources to do that, often, unfortunately, sometimes jail is the resolution. And I know there's some discussion, or I know there's some hope for the diversion program as part of the new jail. But I just wanted, and I think that's huge, but and very important, but there's going to be some crimes that aren't allowable for that, whether it's DV or DUI or certain ones that just have some mandatory restrictions that go along with them. And I guess I just want to throw out there the possibility of treatment inpatient as an option for potentially incarceration, or like a reduced sentence for, some encouragement to go along with that as well, so it's looks more enticing than incarceration. So anyways, I'm just going to throw that out there because I know there's a lot of planning and a lot of hope for the diversion in the jail and the behavioral care center. And I just hoping that could also be a piece of the pie. Thank you.
Excellent. Thank you. Yeah, it feels like that's going to tie in really nicely to Peter, to your update on the BCC and right later on today. All right, Pamela, you're up again, I think. Yes.
Yes, I'm back. So that Snohomish County diversion is Pioneer Human Services. So that's the company that I am part of. And I think my boss is one of the leaders in that organization. So I could easily ask if we would like a speaker from that arena, if that's what the group would be interested in.
I'm sorry, what is it called?
The Snohomish County Diversion Center is Pioneer Human Services. It's run by the same organization that I work for.
Okay.
So I could, and I believe my boss is also supervision over there at that facility as well as mine. So City Gate Apartments being mine. So if we're interested in a speaker, I will definitely drop that request.
Okay, awesome. Gosh, we have so many good ideas here. The other one that you had brought up earlier, I think, Hannah, that you were talking about the whole thing about the courts. You started with it, and it had to do with the courts and saying like that the release happened at 2 a.m. Can you say more about that? Because this was another one that felt really, really relevant and connected to what some of the panelists had mentioned.
Yeah, and Caleb, feel free to interject whenever if you would like to. But if the jail receives a court order and it doesn't have a specific time or specific conditions for release, then the jail is going to process it as quickly as possible because they have to. And so if it doesn't say a specific time and they get to it on the weekend or late on a Friday night, then they have to release that person. But if the court order says you have to, they should be released at Monday at 8 a.m. or 9 a.m., then they have to be released at that time because the court is holding them until then. And that's what we do for people who are being released for substance use treatment. If they're going to a facility, there's specific language in the release order that says when they should be released, who they're released to, why they're going. And so when we don't have that coordination, a lot of the time we're having our most vulnerable people be released based on the jail's capacity and their legal requirement to release people as soon as the court tells them to. And so it's really difficult. We love conditional releases that say specific details about, maybe somebody has to be evaluated by a designated crisis responder before they're released because they have symptoms that make them potentially a risk to themselves or others. And so that's a condition of their release. So I would love to see that more and how we can just coordinate better with the courts to make that a more regular occurrence because we are seeing so many people with serious mental illness and co-occurring substance use disorders who don't have housing. And so I think this whole discussion about housing has brought up for me that most of these people are safer in jail because they do not have stable housing. And so from a behavioral health provider standpoint, we would rather see them there, even though it's not preferred, but we'd rather see them there than on the streets and potentially overdosing and dying. And so that's something that we really need to focus on, is making sure that there are more housing options so that jail is not the option, and making sure that we're coordinated in our release planning so that when housing is available, they're released at the appropriate time so that they're not released before housing's available.
Great, thank you. Sapal?
Yeah, good afternoon, everybody. I just wanted to share something. Uh, what I hear from my vantage point is that there are a lot of good ideas at the local levels. This is what we 20, 30 people have been discussing for years. And same thing is happening in every county and in larger cities, everything. This is, and most of the things we talk about, everybody else is talking about. There's no, like somebody else has a really secret that they're not sharing with us. I think the latest executive order from the federal government has been on the homelessness, you heard, and I've been briefed on with the NACO, the National Counties Association, people that they are saying housing first is not they're going to pursue. It's been very openly said, and they are looking at that we're going to round up people, create a facility, and put them there, and give them. But we don't even know that what their plans are. But I think that all the ideas we have at local level are practical. And we are the closest people to these issues. And we have quite practical solutions there which can work. But when it comes down to the last end of this pipeline is funding. Counties don't have money. We have ideas. We are able to only implement or operationalize something which is within our purview, or maybe some state money. But even there's no new money coming from state either. What we think about these things I'm talking about from my perspective, and there are higher grade pay scale people who make other decisions. But this is the dilemma we face when we sit down, is it's the same amount of dollars, and we start juggling them, that where we can put so that we can get the best bang for the buck. Mm-hmm. And that is not sufficient, right? So I just wanted to share that some of the things that this can be done and can make a real difference in the communities at our level. But the people who actually make funding decisions, they're way too far away from us and way too far away from actual problems. And they are not listening to the community priorities, our own citizens' priorities, as you hear all the time. And this is not that it is only the current administration. Most of the federal administrations have been a little bit remote from allowing. When I get a chance, I tell every federal elected official that during COVID, the ARPA, the American Rescue Plan funds, was the best funding federal government has ever done to local governments. They give us $40 million. Okay, you guys know, do this money, put sidebar bars on it, can't do this, can't do this, can only do this, which is totally okay. But if they give us that freedom, and at the local level, with local organizations, we can utilize the same money. If the way this $40 million starts from federal government and goes through a pathway, we don't even get 20 in the end. So there are a lot of other things happen to it. So I just wanted to share, because I agonize over these things and see that what we are trying to do and what our limitations are. I thought it would be useful for everybody to think about it. Thank you.
Yeah, thank you, Sapal. That was really helpful. And I also did hear a lot of things that we could dive into that were kind of in that level of the no cost, low cost solutions around coordination and learning about that. Some really generous offers I want to thank Pamela and Miriam, especially for just some offers there, and Dean for things that we could dig into and more information we could gather. Yeah, Caleb, it's really nice to have you here. And Amber, I think you just really set a good bar there with just your vulnerability. So I want to thank you and then everybody for just, here we all are together trying to figure this stuff out. So thank you for just sharing, your experience and your perspectives, because that's how we're going to make this work. Yeah, Miriam, another comment from you, and then we'll transition.
Yeah, thank you, Executive Sapple. I think, I don't know what it's like to have to juggle a budget and lead an entire county. So I'm not going to pretend I know anything about that. I think, what I could try to offer for us to think through is if and as you were talking, I was like trying to think of ways, but I kind of came up with more questions, right? Which I hope that we get to explore and we find answers to. But one of the questions I have is, if money is the biggest barrier, if it's a big barrier, what can we prioritize in this implementation plan that we know will offer the most positive outcomes based on extensive data? So what is out there that we know works and is a long-term solution that we can prioritize since we have limited funding? And then the other question I had is, where else can we find funding? And these are questions, again, I'm not going to pretend I know all the answers to, but I hope we get to explore to maximize just a positive impact in the community.
Awesome, thank you. Okay, so gang, if you have other ideas of speakers or kinds of speakers, or even individual speakers you think would be helpful, and we have a smorgasbord of ideas of what we could use with the next panel. So I'm going to rely on our co-chairs to work on listening to all this and making some judgment calls on that of what would be most helpful. But if you have a strong opinion or even a medium opinion and you want to send it over to Marty, then we'll incorporate your thinking into that conversation. So thank you all. That was really wonderful work. So we're going to shift gears now. We have a lot of important updates to talk about today. And I'm actually going to suggest that we start with Riley so that I don't forget you, Riley, because you weren't in the list.
Oh, I'm unforgettable.
You are not forgettable, but there's so many pieces. So will you start us off, please?
Absolutely. So this one's just real quick. I believe everyone on this call should have gotten our first Justice Project newsletter, which went out very recently. It went out to about 750 people, which is how many people have given us email addresses over the last 10 years around issues around the new jail. And it contained the press release about hiring the design build consultant, updates on various other parts of the Justice Project implementation, as well as explaining some of the terms involved. So we talked about trauma-informed care. So that is going to be a monthly update that will go out. We also shared it on our social media channels. We boosted it on our social media channels, and it was seen by over 6,500 people on Reddit. Ooh. So after lots of months of people saying, hey, you need to tell everyone what we're doing, guess what? We are. So the word's going out, our new website's up, all those gears are turning and folks are cluing in. We got 15 new subscribers to that newsletter since it launched. So just want to let everybody know that is in motion and going strong.
That's great. Thank you. And if you're not getting those updates, everybody make sure you sign up for that. And maybe in the notes, we'll just put that at the top so we make sure. Okay, our next presentation. Visioning work on the 23-hour crisis relief center and the behavioral. About this. So I think Peter, we have so much background sound from you. Do you want to go first and then have Hannah? Because when you're not talking, we should turn off your sound.
Sure. So I'd like to just give a little background here. A number of months ago, we started the IPRTF Behavioral Care Center work group, and that was important because over the last 10 years, we have decided as a community that what we wanted to do was build a trauma-informed design jail with behavioral health supports throughout. And we saw a model in Nashville called the Behavioral Care Center, which was a prosecutorial diversion program that was very attractive to us. And all the people who have been working on the new jail and our behavioral care system have generally come to an agreement that this was a model that we very much liked, but we needed to fit it to Whatcom County. So once the levy was passed and the work of the IPRTF was moving along, and we were getting now STV on board and design builders on board, it became clear that by this summer, we really needed to have a good idea for a prosecutorial diversion model, how it would legally work, and what this behavioral care center would look like here in Whatcom County. So there have been 4 or 5 meetings of this work group. I am really proud of the work that was accomplished. I have seen prosecutors and public defenders and the courts all working together with the representative from the health department, from corrections, sheriff's office, and it's just, it was very inspiring to me. And it's that sort of bridge building and coordination that is going to make this justice project really work and become the model, national model we hope it will be. So Hannah Fisk has been part of this work group, and she has pulled together a document, kind of our model, if you will. And what she's going to show you is nothing has been decided. It's all draft form, as I'm sure she will tell you. But these are some of the agreements that we've come to, and a model is being created. And so I'm going to turn off my sound and hand it over to Hannah.
Thank you. Okay, Hannah, you're up.
Peter, is it okay if I share my screen?
Yeah.
Okay, great. Thanks everybody for having me here. Please stop me if there's any questions. This is part of a presentation that I'm giving to the full IPRTF next week. So just want to let you know, if you want to hear me say the same thing twice, feel free to tune in then. As Peter mentioned, the BCC model is based off of a Nashville model and in custody prosecutorial diversion program, which included inpatient treatment. So when we kind of took that, there's many kind of hurdles that we've gone through, some bumps in the road, and just some information that we've gathered in the process of figuring out our needs and what's the best fit. And so I'm just going to walk through not necessarily the decisions that have been made, because those haven't been made, but kind of the information gathered that's probably going to inform the next steps. Okay, so our big one here is the Behavioral Care Center is going to be a new facility. And so the first kind of hurdle is it in custody or is it out of custody? And I will talk more about that specifically. And because then we get to, is it on site or off site? So if you go out of custody, where is the location and what's makes the most sense? And then when we talk about the goals, we kind of came up with some major key goals that covered several smaller details, but things like we're reducing unnecessary incarceration. We're trying to support pre-filing diversions, trying to get ahead of post-charging diversions or intercept as early as possible, but make sure it's open to anywhere in the intercept model. We're looking at continuing to improve public safety, but doing that through treatment, maximizing as many funding streams as possible, addressing mental illnesses, mental health related disorders, as well as substance use disorders, And it's greatly impacting our legal system. So we're hearing from our legal folks too, is that an outcome of helping people stay out of the judicial process will also reduce their caseloads, which there's some legal processes in place there. What you see here is just a picture. I'm going to use pictures throughout the slides. It just seems to help inform the work, but this is just an image. There's a photo credit there that talks about where this came from. So if you want to look at that, our design team will be designing renderings for us to kind of look at and consider and making more decisions. Up here in the corner is a letter from Eric Ritchie and Sigmar, specifically their office, saying that they are in support of a prosecutorial diversion program. And so they were able to put that in writing, and actually happened really quickly. They've been really on board. And so that's part of our process. And what Peter was mentioning is we're hoping to have a finalized document that also outlines charges that they've already agreed that would be eligible. And then as well as a caveat that more on the table, it just might be circumstantial depending on other factors that have to be considered. Okay, so when we look at in custody versus out of custody, here's our things. Okay, so the in custody model, the pros is that it's a pretty clear legal pathway for charges. It's like you're either eligible or kind of you're not. It has an increase in safety. So in those models, you have corrections officers who are typically like in scrubs. So they look like medical personnel, but it kind of increases safety in the unit. What we found, although, literature and research is fairly limited, is that they typically have higher completion rates. So when you're in custody, people typically complete their treatment, and it's a contained environment. What this means is, like, if I was in jail and and the prosecutor came forth and said, hey, would you like to do this treatment program? And upon completion, we will dismiss your charges. I could walk down the hallway from my jail unit into this treatment. And then if at any point I decide I don't want to do it, I would just walk back down to my cell. And so that's it just lives, that's that contained environment. Some of the cons that we found is that it's really not very flexible. So when you're in custody, you're in custody. And when you can be released, you have to be released. So let's say I was in mid-treatment and I had to be released, because that's how the judicial process works. I can't voluntarily stay and finish my treatment. Likewise, if I got bailed out early on and then I wanted to opt into this, I can't voluntarily go into custody to receive treatment. So you kind of stuck there. You also have to have charges filed. So we can't do pre-charging cases because you can't be in custody without a charge sitting there. It's not Medicaid reimbursable, so the weight of the program will sit on the county. And if we're looking today's dollars, at probably $3 to $5 million operating dollars about in today. So if we're talking 3 to 5 years out, it's going to be a lot more than that. Has a smaller targeted population, and the long-term outcomes aren't quite as supportive. So when we talk about reintegration back into the community, because you're in custody or you're not, they can't like flow back into the community or bring in as many resources. So that's where the studies kind of show the decline is longitudinally, they kind of come off. Okay. Out of custody, pros and cons. So when you go out of custody, it's still a prosecutorial diversion program. It's still in support with our prosecutor's office, but it's Medicaid and insurance reimbursable. So now we have some more funding sources that are coming in. It's been told that it feels more voluntary, so it's more of an anecdotal experience, right? Versus when it's in custody, it doesn't feel, it is, you can't walk out. Versus if it was on a treatment campus, you could leave at any time. And so sometimes people say it feels more voluntary and recovery focused. If you're out of custody, you can have kind of a variety of treatment options. If we wanted to do, a co-occurring treatment facility to 16-bed facilities, if we wanted to do some sort of longer term, 180-day, or like a 3.1 level of care, which we already have, but just as an example, you would have a more variety of options for our community, because you could go in and out of the community. So there's a little bit more legal pathways for those who are released. So if I was in jail, maybe I had a DUI and maybe I got out within 72 hours or a day later, that would be something that's eligible for me. Because it's in the community, I could also go without ever being legally involved. So maybe I'm not doing well and I need treatment, that I could I could go there and I wouldn't have to have a judicial process. So it actually hits intercept 0, which an in custody can't hit. So now we get kind of a more breadth of where it hits in our prevention, and it could be even in pre-conviction still. When we look at our jail data, we're looking at a range of 17 to 27 day average stays in our jail. And so when we talk about evidence-based treatment, we're kind of on this cusp of evidence-based treatment and what you can complete. When we look at the Nashville model, they're at an 18-day average in their behavioral care center. And so when you think about what type of treatment somebody can receive and enter into within 18 days, we're kind of not hitting as much evidence-based treatment as we'd like to. And so when you look at the out of custody models, you can go as medically necessary. And so if somebody needs 45 days, or maybe they only need 14, you have that flexibility. Here's some cons. The cons are that it requires a lot more coordination with legal systems and partners. You really have to have a robust community who supports this, and there's follow through on it. And we need everybody to have this shared vision of what this looks like. The other con is completion rates aren't quite as high. So while they're higher for those who have a prosecutorial diversion maybe hooked to it, like maybe they wouldn't have done that had they not. We see more of a drop off early on, but then those longitudinal studies say that they're more effective. So if you complete the treatment, you're more successful down the road. When we look at this map, Kelsey Schaefer-Paranto is on here. She built this beautiful map for us. And you look at these intercepts are up top. And here we have like our law enforcement involvement, our prosecution involvement. And this green bubble is kind of where an in custody BCC would sit. And it's really not movable because you have to have charges in place. You can't do it any earlier. If we look at an in custody, it can actually sit right here when we're talking about the legal process. So the prosecutor can review your case and engage in a prosecutorial diversion program right there. But you can also access it at any point in this continuum, voluntarily or with a judicial process involved. So that's great. When we're talking about proposals, we're also looking at in custody treatment, which I'll talk more about at the full IPRTF. But this is just a visual of kind of where they sit as it specifically relates to a prosecutorial diversion. Okay, so the next thing is, let's pretend we say, okay, we want an out of custody model. Where do you put it? So this is actually a pretty fun debate. I think that we get lots of good content and lots of different reasons for why what are the pros and cons of on-site versus off-site. So when we talk about on-site with the jail, and you think about somebody who's in jail and they are given this option and they say, I actually want treatment. I want out of jail and I want to complete the treatment. And I want to do this diversion. They could just walk out of the jail, walk right outside, walk in another door. So when we talk about things like Hannah's mentioned about the transportation, being picked up, getting to and from places, it really eliminates that for this specific population. It really kind of strengthens the focus that this is a diversion, right, from custody. So we're trying to get as many people out of custody as possible right into the jail. And again, it can hit at some different intercepts as long as you are in that process. When we talk about coordination with law enforcement, it's a real issue, that this might be easier for them too, right? If it's one drop off, one location, and someone wants to change their mind, or maybe there's probable cause, but they think that there's some wiggle room, they might choose to drop them off at a co-occurring inpatient if that's appropriate for them, if it's right next door. Some cons are that if I got bailed out, or maybe I wasn't involved yet, or I wasn't arrested, maybe I had some legal contact with an officer, but I wasn't doing anything illegal, I would have to drive to the jail site to get that treatment. Or again, so it would kind of be the reverse problem, right? So instead of transporting from jail to the center, if I was in the community, I would have to get out to the jail to get this one specific treatment. I have been told that there is some stigma around placing it with a jail. And so the association of in custody and inpatient treatment, that some people might not want that because it feels too similar. Again, it kind of feels that involuntary vibe to it. And then it's less integrated with our other behavioral health services because it will be quite far out there and removed. So again, another challenge, right, is again, just transportation issues for people who aren't in custody. So it kind of takes away some of those elements if we go out of custody, right? It kind of brings some other elements. But when we talk about offsite, we're talking about offsite at Division Street. It would be potentially co-located with the crisis triage with detox. So when we talk about shared spaces, that seems to kind of be something that would be looked at. And so it would try to kind of catch people earlier on, right? So if somebody is in detox and they could go straight to co-occurring, if they went to crisis triage, could they go straight to their inpatient unit if that was something that they wanted or needed? Now we kind of have the similar reasoning of why if somebody's in jail, it makes sense to walk next door. It's a similar reason why if somebody goes to crisis triage, co-locating it would really help an earlier intervention point. So it helps people who maybe have bailed out, who aren't in custody, get there easily, or the prevention efforts. And we can use this at multiple intercepts again. We're back to if we have it offsite, we have that coordination piece that we'd really have to work on there. If we don't have a strong coordination piece, we might have increased our risk for elopement from somebody who's in custody to getting to that treatment center. And so we'll need a lot more stronger collaboration between the courts and prosecutors and treatment providers from those in custody to that location. And then if there's that probable cause, it may deter some law enforcement officers from going to that crisis center rather than the jail, right? Whatever's easiest there. Okay, I'm gonna move on to the 23-hour. So please let me know if anybody has questions. When we talk about the BCC, and again, being located offsite, so you have to kind of go down the rabbit hole with me a little bit here. We're talking also about the 23-hour, and the 23-hour is part of our justice implementation plan. And this is pretty extensive as far as how much work we've had to put into trying to figure out if we can make this possible. So we received a Commerce grant, and it's about $11 million. We've received some additional funding to really support this capital build. And then right as we were we actually put on RFP, we had an architect ready to go. And then, new RCWs came out and statute around what these models are, reimbursement. And we started hearing some feedback from the limited providers that we know in Washington State about funding problems for operation. So we did a hard pause and said, let's gather some more information. Let's look at what's going on and let's talk to our community about, do we need this exact model if there's funding problems, or is there another version or something else that's going to hit this need? So in short, a 23-hour facility is open 24 hours a day. But the concept is that if you stay under 23 hours and 59 minutes, it's considered outpatient. So you've reduced a significant amount of barriers that inpatient treatment facilities have. So they're open all of the time. They can look quite different. There's recliner models. Some have some sobering beds. It's a place to go when you feel like you're in crisis and you need to be surrounded by people who can help care for you. You can get your basic needs met. You can take a nap. You feel warm. They have to have prescribers on board. They usually do wound care. It's a place to be, especially if you're kind of maybe somebody who's having an episode and would sit in the ER lobby for 6 hours and then be released back out to the community. This would be an alternative to that. You'd also have people who just be able to help you, like if you're having high suicidal ideation or thoughts of harm, like you could go here and feel safe and have somebody to pay attention. So it's intended to be an alternative to jail or ERs and mitigate some of those factors. It also has a no wrong door for law enforcement. So there's some clear statute that even if you're at capacity, you still have to take a law enforcement drop off, and you have to take the referrals regardless. So you can't have barriers to access for our emergency responders. So when you look at this fancy model, again, that Kelsey did, this is where it sits. So it really is high in prevention. It's really trying to capture before people ever have interactions, although it is heavily utilized by other places by law enforcement. So there is some interaction, but it's pre-arrest and people will drop off here. They usually have 6 to 7 minute drop-offs for law enforcement is typically where they try to sit. So here's the hard part is the funding status for the 23 hours. So again, we have about 14 million in capital dollars secured to build it. But the data points for the operation is that Medicaid pays for about 40% of the budget, just based on who's actually utilizing these facilities. So about 40% have Medicaid, and that in the Medicaid actually covers, for the most part, the cost of which that one person utilizes. But the non-Medicaid, which is around 60%, that portion seems to be anywhere from $4 million to $12 million in a gap. So that could be underinsured, that could be people with catastrophic insurance, that could be Medicare, or people, you know, who have no means. And so it's a really big gap. And we just don't have enough people who've been doing this for years to tell us where, like, how are we closer to the 4 million or are we closer to the 12 million? So it's a really big range, and it's really hard to know what we're going to do as a community, because that is just an uncovered cost that we would have to find somewhere to run this. So we don't really want to build something that we can't operate. That I think we've all done something similar, and it's just not something that I think we'd rather pivot to something that could meet our needs than have an empty facility. There is a state law, House Bill 1813, that came through that kind of changed the structure of some of the funding, but even today, it's still kind of unclear on how that will funnel or if we will actually see additional dollars for our community. So that's supposed to start in January 2026. So I think we were all hoping we'd have more information by now, but we just don't. So when we think about our next steps, I think we kind of think that if we were to have a BCC out of custody, off-site, so again, we kind of have to still, all of those things are all on the table, but if we were to go that way, we would want to co-locate the 23-hour. We'd want a quick drop off. We want somewhere for people to go. And then if co-occurring treatment, crisis triage, or detox, if we all could work together so that it was one place for people to feel seen and heard and get the treatment they need or support they need to find their next steps. What we've done is there's a group of us that convene. We have City of Bellingham representatives, we have Peace Health, we have the North Sound BHASO. There's just some really great partners that are involved on this project, trying to get as much data as possible to really put together, if we were to build it, how many beds or recliners would we need, getting any more information, constantly seeking updated information on funding sources and what people are seeing. We conducted 5 stakeholder feedback sessions this summer and have just summarized all of that data and are looking to put it together. And going to move forward with a recommendation, hopefully in the next month or two. Those are our big steps. So when we talk about kind of this campus idea, the idea is to think about this in a bigger, broader sense. Potentially, if again, we were to go out of custody, off-site, what is kind of the core of the BCC, right? And this is just an example of kind of what we're hoping to come out of all of this process is, you know, is it the crisis relief and co-occurring inpatient treatment? Is that kind of like at the base, that's what we want? What are some other things that have been said that are missing in our community that could be co-located in the same building? So competency restoration, psychiatric urgent care, a reception and access hub where families could go who they don't know which facility to go to. They just walk in a door and someone's there. There's issues with pharmacies, 24-hour pharmacies in our community and our inpatient treatment units. So do we need to do that? We have youth co-occurring issues, right? The treatment issues lacking in our state. So anyways, and then we get to like the housing stuff. So the goal is to try to figure out what are all of these components? What are we advocating for? What is the data saying that we should work towards? And, you know, what can we fund? And so we're trying to fill as many gaps as we can in our continuum. And when it comes to the Justice Project, it's right also, how do we help people stay out of jail? And how do we help people who are in jail get out right now, and how do we help people get treatment? And so we're trying to do all of those things. Again, this is now we're looking at this. If we actually had this campus, we're looking at these yellow pieces. So we have some earlier intercepts. We try to get some in the middle and then some at the end too to transition people over. So we're trying to build that out more robust. So that's the end of this presentation. I would love to hear your thoughts, your feedback from all of your perspectives. Where do you, what are your true sense? Like, how do you see this? What are the things that really stood out to you the most? What are your biggest concerns?
Hannah, that was a phenomenal presentation. And I just want to just give my hats off to you and Peter and everybody else who's been working on this. When is the best, because we're going to have to move on today because we still have a STV, but we want to talk about this, I'm sure. When is the best time? Should we just bring it to the next JPOP?
I won't take that long, by the way. So you can, yeah.
Yeah, but look, there's 7 great questions here. So let's be realistic. Hannah, when's the best time for us to have more in-depth conversation?
Yeah, I think it's now. I think I think we need the information now. I think we need to hear your perspective now as things are moving along. And I think our design team needs more content. And I think we need to feel like we're representing our community well when we say this is what we're putting forth. And the goal is to have as many people in our community from as many different disciplines and backgrounds and experiences to say, oh man, you know, I hear that, but I think you're missing this point, or this is really something over here that would better serve this population. I think we need to hear the wholes now and really get a sense of where you all fall.
Okay.
But
So,
now could be within the next few weeks. You know?
Okay, that's great. So we could at least start. Adam, how much time do you think you'll need? You want like 10 minutes?
Less than that.
Okay. So just realistically, what if we take 10 minutes right now? I'm watching the clock.
And me personally, I'd rather hear, I think it's more valuable for Hannah to get feedback than, it's more beneficial to the project anyways.
15 minutes. And if we, if we don't have public comment, we'll be able to squeeze some more in there. So let's pop the questions back on the screen for a moment. And if you could, please.
Yeah.
And then we'll see what feedback we can get from folks today.
And I'll take anything not on the slide too.
Any other feedback? Great. Okay.
Should I, Miriam, do you want?
Yeah, I'm going to call people in a second.
Okay. Oh, sorry.
Look at the questions. Okay, so I'll call on people now. So Miriam, go ahead.
Yeah, I just want to echo that this is what I'm talking about. This is what I'm talking about when all the questions, all the comments from community, what's going on, what is it going to look like, and the level of care that's been put into figuring out what's going to work best, and the ask for community feedback, community from everywhere feedback is really great. I'm getting really excited because I can't answer all these questions outright. But my ask is, could you come present to the Racial Equity Commission? Because I believe that we have set up some structure for giving this exact kind of feedback. And I think they would love to hear. We could also do our data committee, but I think that you would get a lot of valuable information because you've laid out the pros and cons of everything and at which levels it would be the most beneficial or where they would fall in that intercept model. And I feel that's really helpful and valuable for us to sit down and talk about and really think through. And I wish I had more answers for you, but I feel like this is something I need to take with me and sit with and also present to other folks in the community and try to get their feedback as well. But I just wanted to say, this is amazing and so incredibly helpful.
Yeah, absolutely. Miriam, just send me an email. I'm happy to come present and I can do the full thing as well. Yeah.
Great. Thank you. All right, Dan.
Yeah, thanks. Good afternoon, everyone. So want to address question 2 and number 5. Should the BCC be on site or with the jail or off-site with Division Street campus? We're talking about in custody and out of custody. We're being presented with a binary choice here. It's either one or the other, and I'm just wondering if we could do both. If we could have a small-ish on-site at La Bounty for a behavioral care center with, I don't know, whatever amount of beds would make sense, and then a small-ish out of custody site at Division to be co-located with the Division Street Behavioral Health Campus. So I don't know if that's possible or not. And then number 5, which parts raise the most questions for you? I think it's how do we pay for the 23-hour care facility, behavioral health facility, given the funding gap is between 4 and 12 million. That's a huge delta. So I think that needs to be addressed. And with only 40% of Medicaid reimbursement funds going towards that facility, we need to get that figured out. Without operational dollars, this thing is dead in the water. So I want to make sure that we address those considerations. Thanks.
Thanks, Dan. Thank you for pointing out the binary, and it's because it feels like one to me. I think when you think of a small BCC, you're talking 16 beds. You typically would never go smaller than 16, and really it's there's some legislation in place that makes it so you can't go higher than 16 without a waiver. But anyway, I would say that most inpatient treatment providers would say that that's cost ineffective as it is. So to go smaller would probably not reduce the cost. You would probably still see a $3 to $5 million cost to run that facility. So kind of what the concept is, and again, I'll give that full presentation on Monday, which is missed here, but if we go out of custody and build that, let's get as many people out of custody as we can to get them the treatment. And for those who can't get out of custody for whatever reason, right? Because they're, bail status, I'm not legal, but because of their charges, the charges would have never been chosen anyways, right? Maybe there's a victim involved, maybe it's too severe, they're waiting for trial, it's just not an option. The idea is, instead of maybe doing an in custody BCC, let's flip it and do intensive outpatient programming in custody for people who wouldn't have been eligible anyways. And so that can be used in their court process. We have Judge Jones who's agreed to that and said that he would love to use voluntary treatment that was accessible to people in custody in his sentencing courts. And so they could still be used. And then if they get released, they would be eligible for that out of custody. So it does feel binary. I would love to do all of the things. I don't know if we would choose to do both if we had all of those dollars, because we would still miss the people who are stuck in jail, right? Who wouldn't be eligible for the inpatient treatment. So it's a great question. I'm going to write it down. And I wish I could just do all of the things.
Hey,
That
Holly, can I
price tag,
follow
the
up?
$3 to $5 million. Yeah, that $3 to $5 million price tag is hard.
Sure. Can I follow up real quick, Holly? Is that okay? I'll be quick. Hannah, so my understanding is the BCC is more of a Whatcom County / all the cities in Whatcom County type facility, and then the 23-hour care facility could be more of a regional facility. Am I getting that straight or not?
Well, I think technically when you take Medicaid dollars, you're not denying anybody, right?
Right.
So, in theory, any facilities we run, they're for everybody. I guess it could be thought of that 23 hours might be more regional because they are heavily relied on our regional ASO. So when another 23-hour in our region comes on board, that's pulling from the same pool of funding. So, right, like Snohomish has one coming on board. And in fact, they actually have a second crisis facility. And then we have some coming into Skagit. So those all pull from the same pool. And we've been told there's really not any dollars left. So yeah, I can see how it could be considered regional in that sense. And I don't know if you think about 23 hours, if you would drive 2 hours away to go to a 23-hour, right? But
Thank you.
Yeah, I'm going to write that down.
Yeah, that's helpful. Yeah, Peter, go ahead.
I think that it's key to say that we are Within our work group, I believe we are dedicated to the idea that the best choice would be to have behavioral health supports and treatment in the jail, not just in the BCC offsite out of custody. And that let's remember that our aim is to design the entire jail as a trauma-informed design facility. And those of us who went to Nashville, what we witnessed was a plain old jail and a BCC that then the BCC was this brilliant other environment that was a place for healing. So what we're wanting to do is make the whole facility a place for healing, designed, trauma-informed design throughout with behavioral health supports and treatment also in the BCC, wherever it might be.
Great, thank you. Okay, we have like 3 more minutes. So other responses to these questions or other thoughts people would like to share? Dan, go ahead.
Yeah, so I think it's important for us to have some consideration around funding, especially from the city of Bellingham, which has made commitments to behavioral health care funding after the capital components of the jail facility are completed. And so it would be helpful. I think Jason Corneliuson is on this call. It would be helpful to have what those funding, those funds look like, and when they start to really kind of tip from capital into more intense behavioral health care dollars. I think that would help inform number 6. Are there needs, services, or perspectives you feel are missing from these plans? I'd say, yeah, funding is like, we need to understand fully what that's going to look like. Let's say, starting in 2028 or 2029 or whatever the year is when we start to tip away from capital investment and go more towards behavioral health dollars. That could really make the difference between these items that we're talking about here today. Thanks.
Thanks. Great. Okay, anybody else? Okay. Again, that was just such an awesome presentation. And so I think our next IPRTF meeting is coming up on Monday at 9 a.m., correct? And you're going to present more of the same material. Hannah? I might be frozen, or you're frozen. Hannah, that's correct, right? Monday at
This
9.
Hannah? Sorry.
Yeah.
I don't ever know which Hannah you're talking to.
Oh, sorry. Hannah Fisk.
Yes,
9
yeah.
a.m. at the IPRTF meeting, correct?
Yeah.
So people can hear more. Wonderful. Thank you so much. And Peter, thank you for your leadership in pulling things together. And yeah, so thought-provoking. All right, let's transition then. We're going to hear from Adam from STV. And Adam, so glad you made it today to talk with us. Thank you for being here. And the floor is yours.
Great.
Are you going to show us a slide?
Yeah, it was not letting me, now it is. There we go. Okay. So, there we go. You should be seeing my screen now. Yes, that's a nod. I got a nod. Okay, good. So this is our schedule where we're at. So that's part of what I'm talking about here today. Somewhat similar to the last time I was here, which has been a little while. And thank you for having me. Enjoyed the discussion and listening in today. So we do have a design builder on board. So yay. We're very excited about that. So for those that don't know, it's Clark Construction is the GC, is our design builder. They partnered with Ram Construction locally as a local GC partner who's going to be doing a lot of our earthwork. Nelson Worldwide is the architect, who's going to be leading the architectural design. They're known, they're a national firm that's done a lot of justice work. And they're also partnered with RMC, a local architect as well. So a lot of national expertise as well as a lot of local connections. And again, we've made local a big priority, and we'll be having we've already brought local subcontractors on board, or we'll be bringing local subcontractors on board, starting with civil and more to come on that. But anyways, they're under contract. They've already started working. But we're in the very early stages. So we've gone through the intent award. We've got them under contract. You've seen sounds like some of you have seen the jail capacity analysis, and beginning what we're calling the validation phase. So this is really to validate the program. I think last time I was here, talked about, we're really looking at trying to develop a number of different scenarios or options for the county to evaluate, to then narrow down to one sort of program design, and then start that design in Q1 of next year, or after Q1 of next year, rather. So that's where we're starting now. The discussions that we've had now, Hannah's work with the BCC is really informing a lot of that. That's one piece of that. So we've been having a lot of discussions around that. We're also working, see on the bottom right of your screen, behavioral health analysis. So that's taken a few different attempts to get a scope of work together for that. But I think we have the right team now, which is some of the members of our design build team actually now have that expertise on their team. A firm called Pulitzer Bogard that does this. They're also nationally recognized, have some statisticians under them as well. So we've already begun a data request from the jail, but also some of the municipalities, behavioral health, as well as the courts, to look at things like different types of cases, times that people are waiting for jail, or like length of time that people are waiting for a case, the types of cases that people have in jail. Part of this is to also inform things like diversion. So you saw the document from the prosecutor's office that Hannah had there. So it sounds like there's, beginning to be some sort of consensus around what types of offenses may be eligible for some sort of diversion, right? If we go that route. So evaluating all of that in hand and trying to project out what the size of this behavioral care center might be, right? So you're asking about operational costs. Well, we don't know what those operational costs are going to be until we know what the size of the thing is going to be, right? So those are two pieces that need to go together. And we don't know what size of the thing is going to be until we know how many people are going to be utilizing this center. And so we need the data to inform that. Some of that's going to be, what I just talked about. There's other pieces that escape me right now, but there's a lot of other pieces of data, including what was in the jail capacity that we got that informed the jail capacity analysis, as well as things like population trends, things like that. So to help us project out for the future. All that to say that that work is still ongoing and will be ongoing through the next several months as part of that scenario development. We'll still be doing subcontractor outreach, community engagement, which I'll talk about in a moment. 2 weeks ago, we had a outreach event already, trying to do outreach for the subcontractor community, the Port of Bellingham at a Meet the Agencies and Primes event. We'll continue doing that as the project progresses to really try to get the word out, for local and minority, women-owned businesses, small businesses, try to increase those numbers as much as we can and do all the outreach that we can for the local community. As far as community engagement, it was Monday. I was going to say last week, but it was Monday. Peter and Councilman Buchanan and others, and then members of the design build team, were meeting to discuss upcoming town halls and how that might look And I think we're targeting November. I think this says October here, but I think we're targeting November now to allow for enough time to get the word out and people to save the date, and also lock down some locations, things like that. So, we want to make sure we're able to do it, somewhere like Bellingham, obviously, to get a lot of turnout, but also in more rural parts, probably Ferndale, since that's where the jail is going to be located. We want community members to have a say in like the jail where the jail is going to be located, obviously. So obviously we'll want to, we'll notify everybody as much as possible, social media, the email, Riley's email list, obviously IPRTF, JPOP, everybody, and get the word out as much as possible. And really that'll be a time to interact, not with, county executive or council members as much as the design build team, and talk about, design of the jail itself, and things like that. So it's not really a time to talk about, what are my tax dollars going to? It's more like, hey, this is what we're building. Like here's time to have input into what this project is going to be, right? And not so much paint colors on the inside or anything like that as much, but hopefully it's very interactive and people can feel heard and have meaningful input. That's the goal of that. Our architects have done this and ran this type of event several times before, and so we feel pretty good about that. So up on the screen here, programming, we'll continue through the end of the year and then into Q1 of next year. Again, working towards like, I know it says cost certainty, but really sort of like an estimate is what we'll have at the end of Q1. We won't have cost certainty until much later in the project, but we'll have a good idea of an estimate based on what we're looking for in terms of number of beds, general size of the facility, if we're doing a behavioral care center on-site or off-site, and what the size of that is. So once all that's determined, we'll have rough estimates and then get everybody's blessing and proceed. And during that time, there'll be a lot of time for review, right? So IPRTF, council, FAB, right? So the idea is that this is a pretty transparent process and people are getting to know what we're up to and not, it's all done in secret and then we come out and say, this is what we're doing. But, we want to be able to present this, like I said, IPRTF, FAB, council, and give people a few opportunities to have, comment period. You see down here the JAW, the Joint Advisory Work Group, basically a subcommittee of FAB. We love our acronyms, right? So that's what JAW stands for. It's members of FAB as well as council. And that's going to help us make decisions very fast or very quickly. Folks that can sit in during some of the design meetings to help move some of this scenario development discussions along. That way that, nothing is a huge surprise for either FAB or council, and we can, start to develop buy-in as we're going, because the key to this process is going to be moving quickly. And no offense to the government employees on the call, I've been there myself, but we all know how fast government can move at times. And, in projects like this, time is literally money. So, and a progressive design build process can really break down when decisions become delayed and delayed and delayed. There ends up being a lot of sitting around time, and we don't want to pay people to sit around. So we do need to make decisions quickly. And also we're trying to hit weather windows for construction, things like that. We don't want to be digging during the rainiest seasons and things like that. So we also have a schedule to keep in mind here too. So the rest of the calendar here is on the board here, right? So we're going to finalize our scenarios and begin schematic design in April or May of next year, and that's really when we start to put a design together. Boxes on paper, start to put rooms on paper and really think through what this building is really going to look like. Prior to that, there'll be some basic cartoon type shapes, some blocking and stacking type diagrams, but nothing that's set in stone at that point. Some general adjacencies, but nothing that's like, this is what the building is really going to look like. That won't start until the schematic design period begins. I don't know if there was anything different here. This is kind of, some things that we're looking at as far as, what some scenarios might look like. So please don't get too hung up on any of this. And again, none of this is like proportional either. But these are some scenario sort of, things that we gave the design builder to look at. And if you saw the jail capacity analysis, some of this should be fairly familiar. So things below the line that we're always going to be looking at are the estimated operational costs during the scenario development. So operational costs for the behavioral care center, the jail, we're always going to have FF&E, and that's furniture, fixtures, and equipment. So that's things like chairs, beds, mattresses, televisions, the computers, all that kind of stuff. So that's furniture, fixtures, and equipment. You're always going to have that in a project like this. We're always going to pay for design. So the existing jail does need to be demoed. But with that, the courts are located downtown, right? And sort of by law, court needs to happen at the county seat. And so there does need to be some new holding area constructed when the existing jail gets demoed. Part of the existing jail being demoed is also a huge benefit to the county because of the Clean Building Act. It's nowhere near compliance, so the county would start to get fined at some point for it not being in compliance. So the holding area is really just for folks that are there to be held during court proceedings. It's not to build new beds for for that purpose. It's really just for holding. So that does need to happen. The 2050 core services, what that means is, we're trying to think of future expandability at some point so that, expansion always, happens at some point. You don't want to box yourself into a corner and make things more expensive when that needs to happen. So sizing things like your water main correctly, your electrical feed correctly. It means, your kitchen's big enough to accommodate future expansion. Doesn't mean you need to put in all the laundry right now, but you're gonna make sure that your everything's there for the future. So not all the laundry machines now, but enough space to accommodate future laundry machines and doors big enough to put those, get those in and out, those types of things. The courts have asked for some courtrooms out there. Those are for like first appearance, things like that. So, and video court, things like that, so that there isn't a whole lot of transfer from this site to downtown to do things like that. Special housing. So this was a discussion earlier. In the jail capacity analysis, there's a slide that talks about what special housing is. So that is specialized for behavioral healthcare needs. Caleb can probably, I don't know if Caleb's still on the phone or call, but he could probably talk a little bit more about what that looks like at some point. But that's also medical. That is acute care. That is transgender. That is veteran housing. All those types of special housing. There's one of the slides in the, like I said, in the capacity analysis that kind of goes through what special housing looks like. The orientation beds, that's basically a unit for when people come into the facility for the first time. That's, the idea is that folks are there for the first 48 hours or so to be monitored, classified. That's where they would get their first typically like a nurse visit, things like that. Again, Caleb could probably talk a lot more eloquently than I could about that. But the idea is that they go there, they're watched, and then if they haven't already been like, oh, this person needs to be an acute and needs to be watched, then they, are often then like, okay, this person can go to general population, or maybe this person does need to go into special housing, those types of things. But the idea is that they're there for the first 24, 48 hours, or hopefully, maybe they bailed out or were diverted or something like that out of that housing unit. The non-rated beds, those are the holding cells, like the booking cells in booking. So those are non-rated beds. So those would be any of the padded cells or the detox beds. So those are all non-rated beds. So those are sort of some of the core things that we're looking at. And then on top of that, whatever that number of general population beds happens to be. And then everything above that is what we're looking at for possible services within the behavioral care center. So that was a lot of information.
That was a lot of information. Thank you so much for preparing that.
I'm sure there are no questions, right?
Yeah, well,
From this group.
we're just past 4 o'clock, so we're
Okay.
probably gonna ask you to come back, Adam, so we
I
can
think
hear
I don't
more.
know if we're in IPRTF or not, but we'll
All right.
see.
Yeah.
Yeah.
But thank you so much. This was super helpful to get to see. So, I think we can stop share. There we go. All right, everybody. Well, it's 4:02. I just want to say that if we have public comment here, I want to create space for that, and we'll stay late if we need to. Any public comment at this time? Okay, hearing none, then let's just go ahead and wrap up, Marty, with our next steps, please. Oh, yeah, vacancies. Okay. Thank you guys for staying a few minutes after here today. So, Marty, go ahead.
I just wanted to make a couple of quick comments. One is that we do have 4 vacancies on the JPOP, and you can see them here. And I just want to say that we got so much information today. We often do. And you all are great lines of communication out to your constituencies. And I hope that you will share what you've heard here, what you hear at JPOP meetings with your networks of people, and tell them where they can find information. Tell them to sign up for the executive's office e-newsletter. Tell them about the websites. Tell them about the vacancies that we have on the JPOP, and that if you think they would be a good person to apply for that. And tell them once we know the dates of the town halls coming up, we JPOP people will be great conduits of information to the community to get people to attend those. So thank you for being those people. And then just the next meeting of this group is October 16th. But remember, on Monday at 9 o'clock coming up, Monday the 22nd, is the IPRTF meeting, where you'll hear a lot more about the Behavioral Care Center crisis, 23-hour crisis relief center, and good discussion about that if you can attend. It's open to the public. So
Great. Thank you so much. Okay, everybody, I think we're ready to wrap up. Thanks for staying a little bit late. Really appreciate all of you. And we will see you either at the IPRTF meeting or at our next meeting in October. So thank you all so much. Have a great rest of your day.
thank you.